Ventricular systole. Left ventricular volume and pressure changes with cardiac cycle. The end diastolic ventricular volume is about 120 milliliter. The ventricular pressure at this point exceeds the atrial pressure, and this causes the AV valves to close. The AV valves have closed and the semilunar valves are not yet open. The ventricles are a closed chamber. Ventricular contraction during this phase causes the ventricular pressure to rise abruptly without any change in ventricular volume. This is the isovolumetric contraction phase and lasts for about 0.05 seconds. When the pressures in the left and right ventricles exceed the diastolic pressures in the aorta, 80 millimeters of mercury, and pulmonary artery, millimeters of mercury, the aortic and pulmonary valves open and the phase of ejection begins. Ejection is rapid in the first third of the period of ejection, rapid ejection phase, with almost 70% of the ventricular blood emptying occurring during this phase. The intraventricular pressure reaches a peak during this phase and then declines before the ventricular systole ends. Slow ejection phase. Isovolumetric contraction. AV valves closed. Aortic and pulmonary valves closed. Phase of ejection. AV valves closed. Aortic and pulmonary valves open.